My name is Ephraim. Today I'm going to present you my personal project, which is on in pursuit of forecasting mental health and its well-being. Our project we're going to examine suicide rate across diverse demographics, and with in pursuit of for studying mental health and well-being, our project delves into critical examination of suicide rate across diverse demographics. Armed with this comprehensive data set encompassed such as countries, gender, age, our mission is to employ advanced analytics to uncover the hidden insights. Meet Tom. He's an advocate and CEO of Save Lives. He's envisioned his company implementing innovative strategies to minimize suicide and extend vital support. The prevalence of suicide represents the actual global health challenge. According to 2019 study by WHO, suicide accounts 700,000 deaths worldwide, which is equivalent to 1.3% of the total reported deaths worldwide. This statistics underscores suicide as the 17th leading cause of death in 2019. Our project to examine the demographic and generational patterns throughout these 3 decades of years, and by analyzing data, we're going to give an insight for our client. These are our KPIs. When we go further, we have total suicide, which is again divided by male and female, suicide rate, and total population. And of course, all have their own year-over-year values. And also, the data dictionary, we have our main data set with a calendar table and refresh date. This project, which is aimed to show how suicide is a silent killer throughout the world, despite the total global suicide accounts of 7 million and the suicide rate shows 0.38, this reveals the complex interplay between the population dynamic. The year-over-year values or changes highlight integrational values, which is the suicide year-over-year, it shows an increase of 2.18, while suicide rate year-over-year shows a little bit decrease with 1.6% total. This prompts the need for comprehensive analysis to understand the underlying influential global relation. If we see our finding or insight, suicide year-over-year globally between 2009 and 2010, it shows an increase, a decrease, and suicide rate in between 2013 and 2015, it shows a great deal of decrease. And if we see right here with our data, in 2019, there was a notable 1.23 decrease in suicide-related deaths, marking a positive trend in the battle against suicide. The positive trend, it continues to 2010. Again, it shows a remarkable change with 0.85 decrease. This signifies the substantial improvement in whatever mechanism that we are using, it shows it's working. And if we see the suicide rate in 2013, it shows 1.86 positive trend, and this positive trend continues to 2014, shows another decrease, and remarkably, the 2015 also shows another decrease. This consecutive decrease, it highlights the effectiveness of ongoing efforts in suicide prevention. When we come to the negative insights, between 1991 and 1994, suicide shows a remarkable increase, whereas in 2012, suicide rate shows a great increase. If we saw it on our data in 1991, our data shows an increase of 2.41 and followed by more substantial changes, which is 5.15. And again, in 1993, it shows a great deal of increase. Whereas when we see the suicide year-over-year, in 2012, it shows markable concern trends with 1.42 increase. This consecutive increase underscores the critical period in which suicide prevention effort face the challenge. Based on this, we come up with suggestions. The first suggestion I have is tailored interventions. Addressing the higher suicide rate in Asia, which is 2.6 million, in Europe, which is 2.2 million, Suicide prevention efforts must consider cultural factors, necessitating regional specific mental health campaigns to reduce the stigma and foster understanding. The second one is generation-specific mental health. As we see, the boomers, which is 2.3 million in the silent generation, have 1.8 million. This initiative should design considering a unique need and pressure that faces the challenge of each generation. And lastly, a generation-sensitive suicide prevention initiative. This signifies the disparity in suicide rate, with 76.89 men and 23.11 females are influenced by this. This approach acknowledges the social stereotype around masculinity and mental health. Those are the suggestions that I'm proposing to Tom. He expressed his satisfaction with overall project, and it has the discrete integrity this suggestion with his company and policy goals. Thank you very much.